Ectopic pregnancy. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom. So if you don't know what ectopic pregnancy means, it means the ovum is implanted in the fallopian tube or somewhere outside of the uterus. So if you've ever had one yourself, or if you know someone who's had one, this will help you understand what happens between the brain-body disconnect from a German new medicine standpoint, excuse me, that results in the implantation elsewhere besides the uterus. I haven't looked up the statistics on how common it is, but certainly with the fertility issues that we're seeing in this day and age, it's not uncommon, or more common than it used to be, I suppose. So when there's an ectopic pregnancy, usually there's like some disagreement with the woman who's become pregnant or becoming pregnant and the situation, the person that's being conceived with, or things along those lines. And so if there's a situation where a woman has been, there's been forcible intercourse, there's been rape or incest or things like that, those are situations where the brain says there's some type of filth with this pregnancy. I don't want it, so therefore I'm going to do what I can to cause it to implant in the improper place, and then ideally the body will abort it out because it's just not safe for the body to grow the fetus in the fallopian tube. Excuse me. If there's, like we talk about rape, incest, any violence, if there's like, let's say there was intercourse and then the woman determined there was a sexually transmitted infection, STI after that, that can cause there to feel that sense of filth, and then as the ovum passes down through the fallopian tube, it just implants instead of going to the uterus. So that's one way to look at it. If someone is, let's say, living in bondage, or there's an arranged marriage and they feel like they're forced to have that child, then that can cause a woman's body to implant the ovum and the egg in the fallopian tube because it's unwanted, right? And so this can happen if a woman lives in fear. If, for example, if they want a pregnancy, but they're like, they've heard so many horror stories about birthing process, because women love to share their horror stories. I remember when Sarah was pregnant, they tried to, every woman who had ever been pregnant shared, my birth story, let me tell my birth story. If you ever consider getting pregnant, just tell them not to tell you their birth story, because you want it to be your own. But they could want that pregnancy and then but also in the same breath be afraid of it. So keep that in mind. If a person is having an extramarital affair, they could be conflicted, like, is my husband the father of the child, or is my lover the father of the child? So there's this conflict. And as a result, because the person might live in fear of being exposed of having a lover, and their spouse, challenging them to say, is this my child? As a result, that can cause a brain-body disconnect and result in the egg implanting in the fallopian tube. So if a person, let's say, isn't happy where they're living, or they don't feel safe, I mean, just imagine, I haven't looked at the news at all, so I don't know what it's like over in Israel and Gaza right now, but let's just say there was intercourse and a woman got pregnant, and then her brain's like, this is not a safe place to raise a child, so that might cause an implantation in the fallopian tube, and as a result cause potentially a miscarriage later on. But it could be like, I don't want to live in this city, I don't want to live in this town. Maybe they live in a dangerous part of town, and maybe it doesn't have to be as extreme as Gaza and Israel right now, but it can be as simple as, I live, in parts of town where there's gunfire and it feels dangerous, and I don't want to raise a child here. That can then cause a woman's body to have that disconnect. So, if a woman is maybe wanting a relationship or to maintain someone in their life, like they say they want a spouse or they want their partner to stay with them, they might want that pregnancy for the other person, not necessarily for themselves. As a result, the body has that conflict, like, I don't really want the baby. I mean, of course, a terrible thought, but they want that to be sort of a trap, shall we say. And so that the body's like, I don't like that disconnect, I don't like how it feels. And as a result, there's a disconnect. So a lot of different varieties here as far as what can cause a woman's body to implant that egg in the fallopian tube. So just take that into consideration as you observe yourself, your body, your experiences. Maybe you can overlay it on your past experiences if you ever had an ectopic pregnancy. People who have gone through that. A lot of women, think that fertility is all their responsibility, which of course is not the case. The male has just as much to do with it. The woman just, of course, has the responsibility of carrying the child. So if you're ever feeling infertile or having fertility issues, you got to look at the male as well. But if you ever have an ectopic pregnancy or you know somebody who has, this will help you have more compassion for them. So if you feel like it's worthwhile sharing, please share it with them and then help them understand themselves and their journey, and it'll help you understand and relate to them better. Okay? If you have comments, please put them below. If you have an idea for a topic or have a question about this, I'll see if I can answer it. But otherwise, we appreciate you, love you, and we'll see you tomorrow. All right, bye.